Hello, everyone. Good afternoon, good morning, and good evening, wherever you're listening to this podcast. Welcome to the Building Bridges podcast, produced under Radas Studios. I am Mevengobu, and today we are going to be shedding more light on mental health awareness. May 2026 has been decided as the Mental Health Awareness Month globally, and we are going to be talking about mental health, which has emerged as a major global public health concern and has contributed significantly over the years to the global burden of this disease worldwide. And mental health is something that affects each and every family, each individual, each member in the community, be it directly or indirectly. And so mental health conditions have increased to about 13% globally over the course of 10 years, and it is due to several pressures such as the socioeconomic pressure, the demographic changes, and the various changes we are experiencing in our society. And so suicide, depression, anxiety has been one of the causes of the reason why a lot of people are being faced with the challenge of mental health. And so it mostly affects people who are aged between 15 and 19. And so today we have persons with lived experience of non-communicable diseases who are going to be sharing with us their experience on how the NCDs has either contributed to a positive mental health or to a negative mental health. And so as we mark the Mental Health Awareness Month 2026 under the theme more good days together, we are trying to create a safe space to talk about something many people experience, but yet they shy away from it. But yet they don't have a space to discuss about it. So in as much as mental health is already a non-communicable disease, but we want to see how someone with a lived experience also goes through some sort of trauma. And I'm very, very happy to have two amazing young warriors. I'm not going to say survivors because they are warriors. They have been living with certain non-communicable disease for over a period of time, and they have been able to wave their way through, to brave their way through, to make it to the studio.
Healthy food choices matter. Save the next generation. Regulate unhealthy foods now.
One, two, three, four.
So I'm just going to begin with the lady before the gentleman. She's going to share her name. Just tell us about yourself. Good morning and welcome to Radar Studios.
Good morning, Meve, and thank you for the opportunity. Thank you for the invitation to be here this morning. My name is Fomekong Christine Sheila, and I am a young warrior, as she said. I live with type 1 diabetes precisely 19 years now. So my experiences throughout the year has made me a warrior.
Wow. Welcome, Sheila. 19 years. That is really, really a long time. We are so glad for you to join us in the studio today. And we will just have the gentleman present himself. Welcome, sir.
Thank you very much, Meve. I am Godfrey Nze, popularly known as Daddy Gray, living with hypertension for the past 30 years plus. And I'm very happy to be here to share my experience, and especially for the topic or the theme this year, that more good days together. I believe that when I share my experience, the days will really become good.
Thank you so much for joining us, Daddy Gray and Sheila. Ladies and gentlemen, as you've seen, they've had at least 19 years and 30 years plus of living with a non-communicable disease. And one thing we should note is that a mentally healthy person is someone who is able to cope with the day-to-day stress. You're able to manage your emotions. You're able to maintain healthy relationships. And we are also able to make good decisions that, of course, goes to contribute to the positive functioning of your life, the challenges you face, and also promote community development. And so we are going to be discussing this with our speakers here, if they have been able to, manage the everyday stress as their warriors with the NCD they have, if they manage their emotions well, if they're able to also maintain these healthy relationships. And so living with type 1 diabetes, living with hypertension is not just a journey of the physical being. I think it has to have to do with mostly your emotions, your inner being, your relationships, the daily routines, how you carry your day-to-day activities, your finances, and overall your mental well-being. And so I want to begin with you, Daddy Gray. Let's begin with the gentleman before the lady. Can you tell us, when you were diagnosed with hypertension, what went through your mind for the very first time? How did you feel at that particular moment when the doctor said, "Sir, this is the case"?
Well, I never knew very much about hypertension, but when I was told that it had no cure because it was a non-communicable disease, I could not imagine myself going. I didn't know how long I would live, and I could not imagine myself going with living on drugs every day of my life. So I was emotionally and mentally disturbed because I could not imagine, like many things were running through my mind.
Wow, so at that moment you were kind of confused, you were anxious, you were kind of afraid that, it's somehow like, I imagine myself taking drugs for over 30 plus years every day. It has a way it weighs you down. Thank you so much for sharing that. It's been very brave. We are talking about mental health awareness and just getting your diagnosis from a disease. At times they say it's even a disease that kills you even before. It's actually your health, your mental health that kills you even before the disease actually kills you. Like, I remember a TikToker was sharing her experience that she went on internship and she was running some tests for herself, and then they told her she has HIV. She was like, she cannot believe it. She lived in denial for a while, and somehow, it was a wrong results that were given to her. Sheila, was it the same thing with you? Did you have the same experience?
Well, I will say I somehow did when I came to the realization of the condition I had. Well, my own story with my diagnosis was somehow a little bit funny. I was still very little, 12 years by then. So my uncle took me to this clinic, and when the results came out, they said I was diabetic. What did I really even know about diabetes? So I thought, okay, it's like malaria. It's going to go away somehow, definitely with medications and the rest. But I got a glimpse of the seriousness when I was transferred to a public hospital where they had to follow me up. When I reached there, they gave me a bottle of medications that I had to be injecting, and a list. On that list, there was a section to do and there was a section not to do, and all the foods that I used to eat were on the sections not to do. So it was like my mind went off. Then having to adjust to the new lifestyle, it became so stressful because first of all, I had to inject myself, and not even starting with myself doing it, I had to call people to do it. And the reaction of people when they are not comfortable about some certain things. So with time, even in the house, it became a problem. And whenever I had to inject myself, maybe to call for somebody, everybody is like, I am busy. Everybody is like, no, they cannot. So it played a lot on my mental health. Like, my state right now and my state before,
They are two different things.
Way different things.
Quite an experience there. Being young and naive, I'm really curious to know, how did the doctor break the news to you? Did he do some sort of a counseling, or he just said, oh, there, yeah, results, it is what it is?
Well, the doctor did not actually break the news directly to me. He broke the news to my uncle and gave the instructions to my uncle, gave related everything to him. So I was just sitting there like a log of wood, not actually understanding anything that was going on. So when he reached home, he was like, this is your drugs that you have to be injecting. I was like,
Injecting which one?
Injecting which one? At what time? So it was like I was on a monitor, I was on a clock, and it was so devastating. It was so confusing and draining. I had a lot of burnout.
And definitely your mental health was affected.
Definitely.
Daddy Gray, was that your same experience? Did the doctor just tell you, oh, voila, you have hypertension? Or he said, oh, with this condition, with these things, you are supposed to. I think breaking the news also goes as far as how the patient is going to take the news, how it's going to affect their mental health.
I think when I got the final diagnosis, I was already confused because I had to go from one screener to the next screener to the next screener. So, first of all, mentally, I knew there was something very serious because I didn't see any reason why I should go from one screener to the next screener to the next screener and back to the first screener to give me the information. So, when they gave me the information, the final diagnosis that I was hypertensive and I had to be on drugs, I thought, like Sheila just said, I thought it was going to be like some malaria drugs for 7 days.
Really?
But the thing is that not even knowing how many days God had given me, and I had to be on drugs every day of my life, it was not right. I'm sure there were times I will sit and think and go and forget that I had to take my drugs because I'm wondering how people are moving strong and healthy.
Some sort of trauma set
Yeah.
in. And so thank you for sharing your experiences. I think one of the thing that stands out in both experiences was that moment of trauma, just the fact that you have to take medications at this particular time. If you miss it, the do's and the don'ts, the rules and the regulations, it just goes to somehow limit you. You just feel like you're limited. And once your mind is made up that there's that limitation, you can no longer be productive. And we are moving to our next question. Many people think that hypertension, that the greatest question is for you. A lot of people actually think that hypertension only affects the physical health, right? How has it affected you emotionally and mentally over the years? Now we are looking at it from the fact that once you got the news, you were traumatized, you went home. Now, progressively over the course of the 30 years plus, how has it been for you emotionally and mentally?
At first, I had a denial.
Denial.
And yeah, I had
That
a
was
denial.
the first. That was
At
the
first, I
first
had a
thing.
denial. Secondly, I didn't want to live on drugs. So I decided I will default.
Oh,
Yeah.
interesting.
I decided I would default. I will use other means to try to see if I could control. But I was maybe say unfortunate and fortunate that I worked in a hospital environment.
Oh, wow.
And once in a while, somebody came and died because they had defaulted on their treatment. And that affected me. I mean, all of that day, I will be wondering, so I will be next because I've defaulted on my treatment or what? So over the years now, I started adhering to my treatment, trying to follow what the doctor said and hoping that I will live.
So denial is never the option. It's always better to embrace your situation. We should not just focus on mental health just with relation to non-communicable disease. There are times that you might be faced with a situation that it's like it's life and death. Rather than denying it, we should accept the situation. We should not default from that great opinion because it mentally drains you, it exhausts you mentally. It's better to accept your reality, to look for ways to live with it rather than living in denial. And that we had to learn the hard way. I think when he saw persons with lived experience crossing over to the other side, kicking the bucket, giving up the ghost, he had to take the medications by fire, by force. Shella, what has been your experience too over the years with emotionally, mentally type 1 diabetes?
I would say, like the way that the Grace said, my first experience was denial.
True.
I denied that I had the condition up to the point that when I left from Yaoundé, because I was in Yaoundé, when I left from Yaoundé and came here, I had to be registered at the regional hospital for the diabetic program that is there. And the nurse I met, the first thing that she told me was that in order for you to succeed with this condition, you have to accept it. And since from them, that word has always rung behind my mind. Like, I accepted the condition. Well, I would say I accepted it quite alright, and I was getting better. At some point, I decided to default to because it was already becoming too much. I felt like, okay, what is life? So let me better kick the bucket, go away, so that people at least can live freely and do their things. With time, I remember there was this experience I had. I almost lost my life. Like if my family wasn't around, then I would have died that night. So from then it was like a brain reset. Everything just came back to my mind and I was like, okay. So this is what could have actually happened. So from there now I saw that no, I am not living only for myself. There are many people around me who need me, and my family actually also needs me. And one thing that also made me actually outgrow that emotional outburn, that emotional stress, that trauma that I was finding myself in was that each time we had a meeting at the hospital, nurses will always use me as an example. Like most at times when questions needed to be answered, they will call me up. When they needed referral for something, I will be the one they will refer me, that kind of stuff. So it also made me to want to leave. And because of that, that message of accepting the condition was what I told others. When I see people struggling with the condition, maybe not accepting it, I tell you that the first thing that you have to do in order to succeed with the condition is for you to accept it.
Wow, quite an experience there, Sheila. One thing I can pick from everything you've said is acceptance. Accept yourself the way you are. You know, most times mental health, it stems from just little things. You don't like the way you look, probably you have, your eyes are burst out, you just feel uncomfortable. And it's funny how community has a way of drilling you to cause you to start having mental issues. Like you look at somebody, say, oh, your eyes are big. There's the aspect of body shaming and so on and so forth. And then personally, you feel that you're not enough. So you have to accept yourself the way you are. And another thing from Sheila's experience, you're not just living for yourself, you're living for your family, you're living for the community. So if you're going through something, as Sheila had the opportunity for the nurse to tell her that she should accept herself, she should love herself. If not of the near-death experience, I'm not sure you'd have been probably where you are today.
No, I'm not sure.
We don't want to say fortunately or unfortunately, due to that experience, you finally seen a reason why it is important for you to contribute to community development as you're contributing, being the type 1 diabetes warrior that you are. And so, ladies and gentlemen, we are still talking about mental health awareness with the theme for this year, More Good Days Together. And from Sheila's experience, she has been experiencing a lot of good days with Daddy Grade. I've been experiencing a lot of good days. And we are hoping that people around the world, people in Cameroon, people in our communities, we have more good days together. Because the rate of substance abuse, so in particularly just the town of Bamenda, I don't know if we could have some of these youths, especially who are probably frustrated. They are just going through a lot, and so they think that the best thing is for them to go in for drug abuse just to have that temporal aspect of feeling good. And so, Sheila, to you as a young person, how has managing type 1 diabetes helped you to stay mentally strong?
For me, managing type 1 diabetes has helped me to mentally stay strong in the sense that how can I really put it, that I am an example to other people. So it gives me some sort of boost up that, like I said, I'm not just living for myself. People are copying from me. So anything that I do impacts another person's life. So it helps me a lot to stay on track, not to default, not to feel like, okay, the world has come to an end or something. No. But I keep on fighting every day, every single day. I know that there is somebody who will hear my story out there and will feel encouraged about the condition.
Thank you. That's our type 1 diabetes warrior who is living as a role model for other type 1 diabetes, not only type 1 diabetes, other children who have other non-communicable diseases, right? She's standing tall, she's standing strong for you. And so this is our encouragement for you to also stand tall, stand strong. You're a warrior and you brave the situation. Daddy Gray, living with hypertension can be quite challenging. But this year's theme reminds us that more good days together. What does having more good days together mean to you personally? I know you have been having a lot of good days. I think after probably you left from denial and default and then finally accepted it. So what does it mean to you personally?
After the denial I accepted my condition, followed doctor's orders, and saw that my hypertension was under control. And spiritually, I knew that God had something for me to do. And it also came to my mind, and my mental health was improved because I thought if I refuse the doctor's orders, I refuse to follow instructions, I will be committing suicide. So I decided I will not commit suicide by refusing to follow doctor's orders because the treatment or the control was available. And I was happy to be with family. And I also met all the people in the community who have this. It is not a contagious disease. It's not like something you pick from somewhere that you should be shy about. It's just that it's a condition that comes up when you are born or with poor health or poor dieting and lack
Poor
of exercise
nutrition.
and all of that. You will have this. So, like it was good for me to have it because right now, like you said, a warrior. I mean, I can stand anywhere in the world and tell people I have gone through this and this is what has helped me. And so it is not something that you should die of if it's not the time God had designated for you to die, so that you could enjoy your family, you could enjoy your friends, and you'll have better days. And better days does not only mean drinking alcohol, smoking cigarettes, and all of that, but being able, just like Sheila said, help other people go through this. I have, in the community where I live in Bamenda, many people now call me doctor because I'm able to tell them, look, if you do this, you do that, you do this, it will be like this. So it is good that I'm helping people. And I think more good days together will mean that, I will impact the world, not just Bamenda alone.
Wow. More good days together with Dr. Daddy Gray. That has really, really been quite an inspiration to me. And I hope that the listeners, they are feeling, inspired. Sheila, how do you find strength in togetherness, be it with your friends, family? I'm happy that you've had a very supportive family who has, supported you through your journey, your 19 years journey with type 1 diabetes. How do they help, right, to create you more good days together?
Well, how can I really say it? My family, not just blood, but the ones I've made in the hospital, the ones I meet out there, they have really been very supportive. My blood family, personally, I would say there are times that they are very annoying. Let me put it that way.
As human beings, right?
Yeah, well, annoying in the sense that they are very observant to what I do, to what I eat, and whether I take my medications or not. So that is why I say they are annoying in the good sense, because they actually keep me in check.
Because they want more good days together.
Very well. They want more good days together. So there are times that my elder sister will come up to me and tell me that, but I haven't seen you taking your injections anymore. So what's happening? And I'll be like, I've been taking. She'll tell me that, okay, you know that your health depends on that, right? I'm like, I do know that. So even with the people around, there is one thing that I've discovered. Many of us need health education out there.
True.
In order for us to live together, we need health education out there. And going through the communities these days, as I've been going through the diabetic educator training that we have been having, and there are times that you move on the road and somebody is greeting you, you're looking at the person will tell you that you spoke to me about this particular condition. Some actually call me doctor in the quarter.
Oh, we have a lot of doctors here.
And some will tell me that, so that is how you're going viral like that. So it's encouraging, because you know that actually the population, the community is receiving what you are saying and they are listening to you. So it creates a supportive environment. It creates more good days together.
All right. Thank you so much, Sheila, for being, will I say, shining light in the dark, because it has been quite a journey, but we are happy that your mental health has been sane. You've not run mad. It's really, really quite impressive. A lot of people, without the support of family, friends, they will not stand tall. And this is a reminder to everyone who is listening, to community members, to young people, to parents. to always support our children, to support each and every person, no matter what they are going through, because mental health is not something to joke with. Everything starts from the mind. If we have a positive mind, we are going to flourish. But if we have a negative mind, then we are not going to build, we are rather going to destroy. Daddy Gray, please, do you have any message for persons living with hypertension or any chronic illness when it comes to mental health awareness?
Thank you, Mivey. The thing I will tell them is that hypertension is just like any other illness. And if you follow the instructions or you follow your medical instructions well, you will live the same like every other person in the community. And you will not be a burden to anyone. It is only difficult when you think that you are the only one sick. You are not, you are feeling a lot of pain and what other people. But the thing is that if you follow the doctor's instructions, you take your drugs regularly and you do your exercises. It's fun time doing exercises with the people that are in your group or people who do not even know, because they might ask you questions that will help you and keep to your exercises. Then, what kind of foods are you eating? Then you could go ahead and tell them. Like the last time a team from RADA came by talking about healthy food choices and all of that. I took that to heart and made sure I learned a lot about the kind of foods that will help me control my hypertension. So I try to encourage people, and some people do not even believe that what I tell them is true because they are overwhelmed that I have the illness. I've been with it for over 30 years and I still move around and laugh. Like I said, I'm popularly known as that degree. And then I add to it, I said, and he's a bouncing baby boy. So the people, kind of get encouraged, laugh, and some of them, who are depressed, get out of the depression. And I know mental health, the thing is that you get more sick especially when your head is
In your mind.
in your mind.
Yeah, the mind is very powerful. Sheila, any last words for young people living with diabetes or other chronic illnesses?
Okay, my last words is the condition you have is just a chapter in your story. It is not the entire story. And also, in order for you to succeed with whatever condition you have, you need to accept that condition. There is no acceptance. There is no way your mind will be calm, your mind will be at peace with that condition if you do not accept it. There is no way for that.
Acceptance is key. It's the beginning of every solution. Dear listeners, thank you so much for staying through with us on mental health awareness. One thing we should note is that mental health also begins from nutrition. What you eat can either make or mar you. If you eat healthy, you'll be healthy. You will not find yourself wanting in the kind of situation where they'll be breaking you a news and you're going to be confused and traumatized. So stay healthy, live better. That we mentioned the fact that you have to exercise regularly, avoid lots of stress for the people in the corporate world, take breaks during intervals of work, try to rest, relax, practice a lot of self-care, be emotionally intelligent, because at times this mental health is linked to heartbreak. In fact, the youth know what I'm talking about. I think that's going to be a discussion for another day. But then I digress. I come back. RADA is currently running a campaign on mental health awareness on its social media handles. Do well to get engaged. On Facebook, we are Reconciliation and Development Association, and LinkedIn as well. On X, we are at RegDev Cameroon. And stay tuned to other interesting episodes that are upcoming on our podcast. And from us to you, it's bye-bye.
Bye.